always thought it was funny when you watch movies and you see a patient looking up to a physician and expecting the physician to know everything there is to know. How they're going to do, how long they have to live, how this impacts their life. But there's always a little bit of uncertainty, like how their disease is going to affect them, what kind of therapies we need to be thinking about, what the risks are of the therapies, what are the benefits of the therapies. There's a lot of uncertainty in medicine. And I think that's what drives a lot of that gray zone when you think about professionalism.
Having the ability to be able to say, yeah, I really don't know the right answer here. I think you have to be comfortable, right, being human and talking to patients and sort of explain your limitations.
I think one of the problems is that health providers sometimes, because of that privilege we are given, are held to such a high standard that we feel like we are not allowed to make mistakes. And if you have that view, then it's remarkably stressful. And it also prevents you from admitting them because you feel like you let somebody down.
In my experience, people really struggle to admit their errors of omission or commission, either one, especially those little mistakes. I can think of a very recent example, actually, where something wasn't ordered for a patient. A person forgot to do it. And when this young physician in training was talking with the family, he said, well, sometimes in hospital things, are out of our control and they just don't happen as fast as we want them to. Well, the right answer would have been to say, I'm really sorry, I forgot to put the order in. And it's not the nurse's fault, it's not whoever's fault. I just made a mistake and I'm very sorry.
Where I see a potential for breakdown is, was the white count normal? And if the answer is, I didn't look, or I don't know, that's far more important than just saying, yes, it was normal.
You find ways to embellish what you're saying or talk around things, or sometimes maybe outright falsify what you're saying to avoid that kind of public shaming that then leads to reinforcement and a pattern of acceptance. When you look good on rounds, when you've had a positive experience, that reinforces it. If you're not comfortable talking about those very minor things that occur that are part of being a human, it's really difficult to be comfortable talking about those more significant events.
When I was a nurse, I was asked to get some heparin flush, just flush to keep an IV line open, a central line open for a young child. A resident wanted this right away. They were doing a procedure and they needed it quickly. So I left the room, I ran to the nurse's station, I grabbed the little vial that was there on the medicine cart, which is where we kept it, ran back, gave it to him, drew it up, injected it, and the child yelled. And everybody stopped, and thankfully, the resident had infused only a tiny bit. And as soon as it happened, we all knew what happened. I had picked up the wrong vial off the medication cart, and heparin flush looked exactly like a bottle of potassium, which is fatal if he would have pushed in what was in the whole syringe. Thankfully, the child was okay. I wasn't. I almost quit, of course, because I almost really hurt someone. And I couldn't believe I was so stupid and inept and flawed. And it wasn't until 8 years later that on a national level, there was a recommendation to separate look-alike, sound-alike drugs. And it wasn't until that many years later that I realized I wasn't the only one that did that.
I think by talking about professionalism, by allowing people to admit mistakes when they occur, and by sharing best practices on how to fix those mistakes, we will, obviously provide better care for patients and actually provide better care for our professionals, because we need to take care of them too.
What we've tried to start focusing on is how do you model the day-to-day errors of omission or commission that we all have happen, so that the people that are earlier in their training path see that it's not only okay, it's better to be very truthful about that and to be comfortable discussing that, not only with patients and families, but with team members.
One of the most important things we know when harm happens is that we apologize and find out what happened so we can truthfully say to patients, we're doing everything we can to make sure this doesn't happen again, because we know from research that that's what patients want to know. In order to know that we're doing everything we can so this won't happen, we have to look at the processes involved, and we have to look at the behaviors and the choices involved.
Mistakes that harm patients are almost never a mistake that was made in isolation.
Just culture is what leaders use to go through a process to understand why someone made a mistake.
Just Culture is a national effort. Safe Choices is a Duke adoption of that program and a workshop that we've created that talks about how to hold people accountable, how to recognize the errors that humans make that are part of being human, how to recognize the patterns of choices that people make that is different than just random error or routine error of being human. Rather than putting a policy in front of people and saying, this is what we do, we use cases, real cases from the organization that small teams of 10 or 12 people work through and talk about and understand what were the decisions that a staff member or team of members made that caused an outcome, usually not a good outcome, and what could they have done differently. And then we come back together and we talk about those decisions, those choices. We talk about what managers should do in this circumstance. How do you deal with that individual or that team who was involved in an outcome that didn't go well?
I would say that Just Culture was probably one of the most effective forms of communication with frontline staff that supported, tell us what's wrong, tell us what didn't work, tell us why. You're not going to get in trouble. You're going to work with us to make this better. We can then learn from it and transition or translate that information that we learned from that event so that we minimize the risk of that problem, not only in our own unit, but across the system.
The people who participate in these actually score much better in terms of their resilience and their burnout rates. And it seems that this kind of collaborative learning and discussion really helps people feel empowered and feel supported. Acknowledging those errors and managing those errors is a part of being a safe and effective healthcare organization or a safe and effective healthcare professional.